And joining us now to talk about your health is Tanya Nichols, licensed psychologist in the Trauma and Healing Program at Mount Washington Pediatric Hospital. Thank you so much for joining us.
Thank you so much for having me.
One of the things you work on includes child and family traumatic stress. What types of situations are we talking about?
So we're talking about, we may see abuse, physical abuse, sexual abuse, neglect, emotional abuse. We might have kids who've been through a traumatic accident, even medical trauma. We have kids who've experienced traumatic grief and loss. So those are some of the things that we often see and treat.
I cringe when I hear that list and think about the things that young people have to endure sometimes. But you see an opportunity to help.
I do. I think that it's such a critical time in a child's development, and we have a lot of evidence-based treatments that's really helpful to help reduce their traumatic stress, work with their families, help the children to make meaning of what they've gone through, and to be able to move forward in their lives and not have some of the challenges that they've had related to the trauma.
How does the pediatric world differ from adult care in similar situations? And how does it differ if you're talking to a 5-year-old versus a 15-year-old?
Okay, so with children, you're often working with their caregiver, so you have to get the history, the background, what's been going on related to their development, socially what's going on. Sometimes we collaborate with other people who are on their team, so it could be their teachers. They may have a CASA worker, they may have a worker through the DSS. So we collaborate across the interdisciplinary team. We also do behavioral observations. We may do a clinical interview, and some people also come in for a psychological assessment, so where we give different measures and tests to understand their social and emotional functioning. And based on their age, we have to adapt the treatments that we have to make sure that we're flexible. We're engaging children on their developmental level. So with a 5-year-old, you're going to do more play-based kinds of things. With a 15-year-old, you may do some games. They may just want to talk. It really depends on the cognitive level, their chronological levels, a lot of different factors that we take into account.
What's the involvement of the caregiver, which you mean a parent or guardian? And obviously it depends on what the nature of the trauma was.
So with the caregiver, one of the things we want to make sure that the caregiver can regulate themselves so that they can be available to help the child learn the skills that we're teaching them, be able to apply it outside of therapy in other contexts. Also, we do modeling in the sessions in some cases to show them some of the skills in real time, how they can apply it. And I often think about parents and caregivers as kind of like a co-therapist or as a coach, where I'm giving the skills, I'm working with the child in the 1 hour that I have, but then outside of therapy, that's when they're practicing, they're doing that practicing, and they really need their caregiver to really prompt them to use some of the skills sometimes until the child is able to apply it on their own.
Are there cases where the outcome is favorable, where you're optimistic that we can really help this person, and are there other kinds of trauma maybe where it's much tougher?
I think there's a lot of cases, not a particular one type of case, but it really depends on the issue, the child. It's a lot of different factors, but we have a lot of great treatments where we see people get better. We see their traumatic stress decrease. And I think the consistency with coming to therapy, having an involved caregiver, connecting with the child as a therapist, and allowing them to share and really process what's going on once they feel safe. Once they know that this is something that they can get better, we see improvement. In some cases, depending on the trauma, how long it's been going on, it could take longer to treat, but we see a lot of improvements. It's something that's one of the things that makes me excited about this work, is because I see kids getting better, and it's really rewarding.
What have you learned about approaching kids? I would imagine, depending on a number of things, the child might be very standoffish at first. How do you overcome that?
Yeah, I think that you have to really build the rapport, build a connection, really meet them where they're at. Some kids are really excited about coming to therapy, and some people are really scared. And it's understandable, especially if you're coming to talk about really scary things or something bad that happened in their lives, like many of the kids that I work with in our trauma and healing program at Mount Washington. So it takes time. Each child is different, and so you really have to meet them where they're at. You try different approaches to connect, and with time, usually they open up.
You mentioned this is an evidence-based field. What's been learned over the years in terms of things that you can apply in your practice?
So in terms of trauma treatment, one of the things that we know we have to really teach children and their caregivers different emotion regulation strategies. So how to calm themselves, how to relax, and also different cognitive strategies to help them reframe some of their thoughts so that it's more helpful. And then throughout the whole process, we're talking about their trauma. And so we're doing the gradual trauma processing, and then we really once they're more stable, their symptoms have gone down, then we can really get into talking about the trauma in more detail. And that's when we do a really big part of their trauma processing, and we call it a trauma narrative. And so it can take on many different forms, whether it's a poem or whether it's a story. That's just one treatment, but all different trauma therapies involve those same components. They might just approach it differently.
How long does it take? I mean, if somebody at a young age has had a life-altering thing, I mean, they're not going to forget. They're never going to get back to where they should have been. Is that fair? I mean, what's a realistic goal for recovery of what their life and mental health should have been, but for the trauma?
So it really depends on the type of trauma, how long the trauma has been going on. So if we're talking about a single incident, kind of traumatic incident where maybe there was an accident or maybe there was something related to community violence that they witnessed or someone close to them was involved in, we might see 6 months to longer being able to see those symptoms come down. And then sometimes people have recurrent trauma that's been going on for a very long time. So those types of cases take longer, but we still see children being able to make tremendous strides, being able to engage and do the things that they want to do, and having a lot of being able to connect with peers in a better way, doing well in school. So I just think in general, once you connected to therapy and you're accessing it on a regular basis, you're being consistent, there's a lot of hope for kids and their families.
That's great. Mm-hmm. You also specialize in foster care, adoption situations. How can you help there?
So many children who've had an out-of-home placement, they may have experienced some kind of trauma, whether it's separation from a caregiver, maybe the caregiver has a mental illness, maybe the caregiver has a substance use disorder, and so for whatever reason, they may end up in the foster care system. Some end up getting adopted, some get placed with a kinship placement. And so similarly, many of the same treatments that we use with other kids, we use with children who are in the foster care system or who've been adopted.
Tough time to be a young person. Mm-hmm. Think about all the challenges of growing up, now amplified, magnified by social media and phones and other things. What big trends do you see in the overall mental health of the community of young people?
Yeah, I do think that while social media has a lot of perks and it's a lot of pluses and it's changed how we live our lives, it can create a lot more anxiety with children and adolescents. Things can be very public facing. You know, things that would happen at school that wouldn't go public, it can get publicized. So it creates a lot more anxiety, but I think that's why caregivers and teachers and other people who are working with kids are, monitor that usage a lot, because it can go in the wrong direction where it can really impact them.
As a society, how can we do better for our young people? And I mean, that's sort of a broad question, but specifically in the traumatic situations that you deal with.
I think that, being aware, noticing if a child's their behavior has changed, if their emotions or their mood has changed, and checking in and being curious about them. Kind of know your children's baseline, or even teachers, you kind of know the child's baseline or the adolescent's baseline. And so if you notice they're more withdrawn, they're more irritable, they're not engaging, they're not interested in the things that they typically want to engage in, that they would normally engage in, be curious about what's going on, and you might find out that something may have happened that was difficult or troubling or scary for the child.
Can you tell when you're working with a young person? They always talk about how kids are resilient, and kids can also clam up. I guess we all can, and maybe want to hide what's going on. But I'm guessing you can see through that sometimes.
I think that once you establish that connection with the child, and they know that you're a safe person, you're their therapist, you want to know more, you're curious about how they're doing, eventually that some of the guard comes down, and then they're sharing more about how they feel, what their thoughts are, what's bothering them, what's on their mind.
You seem to like what you do.
Yeah, I do.
I'm curious how you got into a difficult, challenging field.
I went into grad school being very open about the different populations that I could work with, and I just found that understanding trauma helped me really understand how people are trying to do the best they can with what they have, and how some of the things that they've been through, how it shaped them, and some behaviors or some things that they had to do help them survive. And in some areas it may not be so helpful, and so it just helped me understand behaviors in a more complex way. And I love working across teams, so with the trauma work you get to work with a lot of different people and to really help the child or adolescent thrive. So that is how I got into it.
Mount Washington Pediatric, and just as a specialist, pediatric specialist, you can help a young person through what age?
So we actually start at infants, and we can work up until, in our clinic, we work up until age 19. The therapies that we have that involve infants, we're doing most of the work with the caregiver, but there are therapies that help child and parent or caregivers with babies as well.
And in just a sentence or so, any other services at Mount Washington Pediatric that you provide to the community that you want people to know about?
That we provide to the community.
Specifically in the mental health field.
Okay, so that's a good question. We do outreach. I know our trauma team, the trauma and healing program that I'm a part of, we do outreach, we do presentations, we provide information to people in the community to let them know that we exist, and that there are lots of great services that they can get for their kid in our department.
Very good. Tanya Nichols with Mount Washington Pediatric Hospital. Dr. Nichols, thank you very much.
Thank you so much for having me.